Niger State House of Assembly House Standing Committee on Health, Nutrition and Primary Health Care has submitted its report calling on the executive arms of Niger State government to provide immediate intervention to address the outbreak of a deadly ulcerative disease in Muya local government area. The chairman of the committee and member representing Paikoro constituency, Honorable Umar Nasser, presented the report at the plenary of the assembly recently. Reports.
In pursuant of the resolution of the House, the committee was mandated to investigate the reported outbreak of the ulcerative diseases, assess the severity and spread of the disease, as well as interface with relevant health authorities and affected persons in order to profile recommendation for immediate intervention. Presenting the report alongside other committee members, Honorable Umar Nasser said after their findings and observations, they discovered that the disease is suspected to be Buruli ulcer, stressing that though confirmation is still pending laboratory results. He said the committee observed varying degrees of the disease across the community, including extremely severe cases requiring urgent attention. Honorable Umar Nasser maintained that a major challenge observed is the lack of public sensitization, which led some victims to delay seeking medical attention, amongst other findings. The committee recommended that the Ministry of Health is called upon to, as a matter of urgency, deploy medical personnel and essential drugs for emergency response.
During the visit, the committee assessed affected persons firsthand and interacted extensively with committee members. Medical samples were taken from various victims by the accompanying medical personnel of the Ministry of Laboratory for laboratory analysis. At Guinea Ward, one of the victims informed the committee that he initially noticed a small painless wound around December 2025, which progressively deteriorated into a severe ulcerative condition. He further disclosed that he relied on traditional method of treatment, which visibly did not yield positive results. Findings and observation. Mr. Speaker, sir, honorable members, after careful assessment of the situation, the committee made the following findings and observation. 1. That the disease is suspected to be Buruli ulcer, though confirmation is still pending laboratory results. 2. The committee observed varying degrees of disease across the communities, including extremely severe cases requiring urgent specialist attention.
He recommended that all affected persons should be immediately provided with free medical treatments, including surgery, wound care and rehabilitation services where necessary, among other recommendations. The committee chairman disclosed that the oversight visit revealed a need for sustained surveillance, enhanced public sensitization, and prompt intervention to effectively manage the suspected Buruli ulcer cases in Munya local government area.
I was invited here by the House Committee on Health, the Maori member from Muya local government, based on this Buruli ulcer that occurred in Muya local government. It's an ulcer, it's a sickness that have drawn attention of all the stakeholders within the local government outside. And we came here to discuss the possible solution for the government to intervene, and the government have done so many things.
So far, we want to appreciate the executive arms of government led by His Excellency, the former Governor Umurubago, the proactiveness we've seen so far, both the executive arms of government and then the legislature, and then the local government, the executive, and then the council of the local government. All hands are on decks. We just concluded a meeting, strategic meeting, where there should be a designated center for all the patients that will be evacuated from one local government to the center for the treatment. That is how the resources should be released and actualized. And we pray that with these efforts from the government, the relief is coming, and then inshallah, everything will come to that end.
Okay, quickly.
I'm Salamatu Muhammad reporting for NSTV News.